Hi, my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm going to talk to you about how to have clear skin by cleaning up your gut. You see, most patients that come into our office these days, which I've been practicing over 30 years and have seen over 100,000 patient visits now, doing chiropractic, nutrition, functional medicine, and most patients that come in amongst the fatigue, pain, headaches, anxiety, brain fog, and all of those symptoms, most all have gut issues. And a lot of the patients that have gut issues, I find, have skin problems. So if you have acne, eczema, psoriasis, random rashes, hives, pretty much, the whole range, that pretty much covers a wide range of skin issues, but most commonly these skin issues are from your gut. So they say your eyes, the mirror to your soul. Well, actually, I think your skin is the mirror to your gut. So if you have issues, oftentimes that manifests. If you have gut issues, it often manifests in your skin. And a great story that recently happened. Well, I just got a text yesterday from a patient. She's 25 years old, and she sent me a picture of her face. Her face was so clear, and she said, "This is 15 days being on the program I put her on, which the free diet and the supplement natural medicine formulas." She went from severe acne to clear skin. In 15 days. So that's how quickly you can turn this around if you clean up your gut issues. So what causes this? Well, in her case, and it often is the case, typically antibiotics are a common cause. So just one, in her case, 2 courses of antibiotics when she had a kidney infection a while back. It basically can cause a intestinal permeability, leaky gut they call it, in which then you can become reactive to foods that you weren't before. So most commonly is like gluten, yeast, dairy is another one, common one. So as you become reactive to these foods, then cause an inflammatory reaction. So these food sensitivities can manifest in a lot of different ways, but one is with acne, eczema, psoriasis, rashes, things like that. So another, besides food sensitivities, pathogens are infections. So in your gut, it can manifest with skin problems. So that would include yeast overgrowth, bacterial or dysbiosis, which is bacterial overgrowth in your intestines, parasites, another cause. This is another pathogen which can cause skin reactions. So those are two ways, the pathogens/infections and food sensitivities, that can really have a really negative effect on your skin and cause these issues. So and other particular causes, like for instance, this young woman, she was also out of the country and got food poisoning. She was really sick, and that you can pick up again bacteria, parasites that way, and that can cause this abnormal bacterial environment and leaky gut, intestinal permeability. So how do we, what are the treatments? Like, how do we clear this up? Well, the standard medical treatment is, like, say for acne, antibiotics. So we give the antibiotics for a month, a year. I remember my brother growing up. My brother was on it for like 2, 3 years, if not more, in high school, and that completely can, although you can get some symptomatic reliefs, it can completely wreak havoc on your gut and immune system long term. And other treatments are like retin-A, which definitely can be effective. It is very toxic. And I had a patient, she's 15, about a year or so ago, taking this, and she had to get monthly, basically you have to get monthly pregnancy tests because it causes birth defects, and you have to get regular, it's so toxic it causes birth defects, and you also have to get regular blood tests to check your liver enzymes and make sure there's no liver damage. So basically they are symptomatic relief solutions, although they have significant side effects. So it really depends. You have two choices. One, you can choose that way, which is certainly a choice, or you can choose health, which is to get to the underlying root causes and then come up with permanent long-term solutions by actually fixing the problem. So I'll briefly outline that, going back to food reactions, food sensitivities. So this particular patient, we were talking about the first one, 25-year-old woman. So it turns out after doing the validation and testing, amongst other things, she was highly sensitive to gluten and yeast. Those are the two really most common ones I see with acne and skin lesions. Dairy is another one. So instead of just putting her on a gluten-free diet, what I find works much more effectively is I call it the free diet, because it's not only gluten-free, but it's free of gluten, all the most common food reaction allergens. So gluten, grains, corn, sugar, yeast, dairy, eggs, soy, legumes, and GMOs. So those 10 foods I find are the most common ones. And this is in doing thousands of food allergen, food sensitivity tests over the years. Those I found are the most common foods that cause inflammatory reactions, including skin issues. So, and if you do want a copy of phase 1 of the free diet, just click on the link below and we'd be happy to send that over to you. So the diet is 1. 2, as far as supplements, I base that based on initial lab results, but general recommendations I find that are most effective for acne and other skin issues are probiotics. So I use a few different kinds, but the most powerful one we use, and what this patient used that got cleared up in 15 days, is Probio Extreme, and that's a probiotic that has over 350 billion of probiotics, 14 different strains. So it's really powerful. So that, and then a product called Yeast Defeat, because the Yeast Defeat helps to balance out your digestive system by keeping yeast in check and creating more of a balance in your gut. So besides helping with skin issues, like this patient also had very severe abdominal pain, cramps, diarrhea, bloating, gas, constipation. She had been to her primary or OBGYN for severe menstrual cramps, PMS. TGI doctors, they told her she had, well, after all these tests and everything, basically IBS is what they told her, which stands for irritable bowel syndrome. So it's kind of interesting because you go in to the doctor and you say, oh yeah, doc, I have, diarrhea, constipation, bloating, gas, just really, my bowels are really irritable and I don't know what's going on. So they do all, evaluation on all the tests and everything. They come back, oh, well, you have irritable bowel syndrome, IBS. Well, I know, that's what I told you. I have irritable bowels, and you're telling me I have IBS. Okay, thank you very much. I have this IBS. Now I know what I have. So it's just all kind of amusing, I think. But anyway, so we have my point was her gut issues cleared up with diet, the supplements, and in turn her skin cleared up. So that's what you want to really focus on, is getting your gut cleared up, and clear up all these, really help clear up these skin issues. Well, if you do know anyone that has skin issues or gut issues and you want to share the video with, feel free to do that. If you want additional videos like this, feel free to subscribe to my YouTube channel, and look forward to, thanks for joining me today, and look forward to seeing you next time. Okay, take care.